Now, while we're on it, let's just briefly go over the six types and what kind of makes each of them unique.
Yes. So the first type is the premature type. And actually, this is one that is a medical diagnosis. There is something called premature menopause. And that is when you have menopause before age 40. And early menopause is menopause between ages 40 and 45, meaning really simply whether it's surgery and your ovaries were taken out or your period stopped and you had lab levels that showed menopause. About 1 to 5% of the population has early menopause. And I had a patient last Friday. She was sitting with me in my New York City office and she said, how rare is this? And I said, well, I think I did the math. And I said like 1%, I'm going to get this wrong, but 1% of 5 million is 50 million is 1% of 50 million. I don't know what the number is.
50,000?
It was either, how
I
much
think
is it?
I think it's 50,000.
50,000, right?
Yeah.
50,000 women a year. And that's just 1%, but we could go up to 5%, right? So I said 50,000 women each year is not nothing either. And I also think that that number is dependent on getting lost in the weeds here, but I'm really passionate about this. I think that number is also getting lost in the weeds because she said also, I haven't seen a doctor in a really long time. And I don't even know if my doctor really even considers the fact that I haven't had periods anymore. So that number, 1 to 5%, is probably an underestimate. Okay. The second type is the sudden menopause type, often due to either something suddenly happening. I think of chemotherapy for cancer treatments. I think of surgery for maybe endometriosis or cysts or cancer again. Thinking of Lupron or certain medications, even high dose steroids. I had a lady who went into menopause after a traumatic car accident. She had a traumatic car accident, boom, never got her periods again. And so for most women, the sudden menopause type is potentially where hormone therapy is not indicated because there are patients here who are suddenly, waking up and taking chemotherapy for cancer. And so this type is really talks a lot about in my book, non-hormonal therapies, but also, different ways of exercising, different ways of treating your body with a sudden type of menopause. A full throttle menopause is exactly what it sounds like. Symptoms from head to toe, hair loss and night sweats and weight gain and fatigue and lack of motivation. And, every single symptom you could think of is really your full throttle menopause. The mind altering menopause, which is type 4, is really near and dear to me as well, because I think there are many women for whom their symptoms are really more mental health appearing, whatever that means. So there still could be a big shift in hormones. And they may get either misdiagnosed with depression, anxiety, bipolar, and there certainly could be multiple factors, but the shift in hormone there is huge. And this is actually one where I say movement really is medicine. There's the lingering menopause type, which is symptoms that just sort of never seem to go away, never as terrible as full throttle or as obvious as sudden menopause, but too many women let menopause symptoms go on for many, many years without feeling as though they are worth treatment or they're worthy of treatment, or they're just taking care of too many other people. And then silent menopause type is really what I touched upon, is that even if you never had a symptom, your body still changes. So what are the exercises you need to do? What are the health tests you still need to do? Because women with silent menopause type may seem lucky on the outside, but if that doesn't remind them that their body's still changing, they may be left at a disadvantage.